Hello, my name is Dr. Blake Cleveland, and I'm an emergency medicine physician at NorthBay Health. Today, we're talking about early heart attack care. Your heart has 4 chambers. Each side of the heart has an upper chamber and a lower chamber. The blood comes into the right side of the heart. It comes into the right atrium and then moves to the right ventricle where it is pumped out to the lungs. And in the lungs is where it exchanges gas, both oxygen that you breathe in and carbon dioxide that you bring out. It then moves past the lungs and then enters the left side of the heart through the left atrium and then down to the left ventricle, which is the main pumping chamber of the heart, and then is sent out to the rest of the body. A heart attack is when one of the arteries that supplies blood to the muscle of the heart gets clogged. This can happen over time because the artery narrows to a point that no blood can pass through it, or the wall of the artery can develop what is called plaque, and that plaque then ruptures and a clotting cascade in the bloodstream ensues, making a clot, and then the heart doesn't get blood. There are common symptoms: chest pain, shortness of breath, nausea, profuse sweating, syncope, which means passing out, palpitations, as well as pain radiating into the arms, the back, or even up into the jaw. These symptoms can be found altogether, or they can be very subtle. Hyperlipidemia, which means the different types of high cholesterol syndromes, problems with the lungs, maybe from smoking, problems with high blood pressure, family risk factors, and other risk factors such as using certain types of drugs like cocaine, amphetamines, and nicotine. The first thing is use your ears. As a bystander, if you can listen and recognize the symptoms of a heart attack, that's how you can help the most, because the next thing that you need to do is call 911, because they're going to have an ambulance crew to you faster than you can potentially get to a hospital.